How well do you know your diathermy unit? Hi, it's Dr. Fan here. Let's talk about the surgical diathermy unit. The backbone of energy devices in surgery is the diathermy unit. You may have heard of terms such as electrocautery and electrosurgery. Let's just clarify the differences here. Electrocautery is used for ablation. It involves using AC/DC current through a probe to generate heat. This current does not pass through the patient and is used primarily to destroy the target tissue at the end of the probe or to cause coagulation to control bleeding. Electrosurgery is the diathermy unit used in operative surgery. This involves a high-frequency AC current at 0.5 to 5 MHz that passes through the patient. This frequency is too high to generate an electrical current in body tissues, which sits at a much lower range of 1 to 10 kHz. This is the reason why the patient does not get electrocuted with the use of electrosurgery. This energy, however, does cause tissue destruction, allowing the tip of the diathermy probe to cut through body tissues. There are two main types of electrosurgery units, being monopolar and bipolar. In monopolar diathermy, the current flows from the machine to the diathermy tip through to the return pad on the patient, before returning to the machine to complete the circuit. The return pad covers a large surface area so that the return energy is spread out over a large area and therefore does not burn the patient. This type of diathermy is the main type used for dissecting and controlling bleeding during the operation. In bipolar diathermy, there are two tips at the end of the diathermy probe. The current flows from the machine, then between these two tips, and does not flow through the rest of the patient in order to return to the machine and complete the circuit. This type of diathermy is lower voltage and more useful in keeping the current localized to smaller, more sensitive areas to avoid inadvertent injury to surrounding areas. The alternating current of the diathermy is represented by a sine wave. There are a number of settings to control the flow of the current. With the cut setting, the current is on 100% of the time, leading to consistent waveform. This creates intense heat of over 100 degrees Celsius, which vaporizes tissue by causing water content of the cells to evaporate, resulting in the immediate destruction of the cell. This allows for a smooth cut through tissue without jarring. With the coagulation setting, the voltage is higher, but the current is only on 6% of the time and alternates with a no current flow for 94% of the time. This causes desiccation or fulguration depending on the diathermy setting. Desiccation occurs at a lower voltage. On contact with the probe, with a temperature of less than 100 degrees Celsius, cells are destroyed through water loss and shrinkage, but the proteins are not completely destroyed and form cross-linkages, which allows them to seal off blood vessels and cause coagulation. This setting is useful in stopping bleeding during dissection. Fulguration occurs at a higher voltage and is a non-contact method of superficially desiccating tissue. This is a good method in controlling a large area of superficial bleeding, such as for hemostasis of liver capsular bleeding. However, it is important to note that the deep tissue will not be affected and may still be bleeding. There is also a blend setting which alternates between the cut and coagulation settings in a 50-50 ratio. As the name suggests, it blends the two techniques together to allow for cutting and coagulating at the same time. It is important to note that there are a number of issues to be aware of when using diathermy. As mentioned earlier, the diathermy return pad needs to be a large surface area in order to spread out the return current and not cause burns. Therefore, we must ensure adequate placement and full contact of the pad, and avoidance of high conduction areas such as metal hardware and implants. The electrical current may also affect implants such as pacemakers. Return electrodes must be placed well away from the pacemaker, and monopolar diathermy should only be used in short bursts. A magnet should also be nearby to reset the pacemaker if required. Metal components such as towel clips and ports located around the diathermy tip or lead may also lead to conduction injuries. Ensure that the tip is visible at all times when using diathermy. This is particularly important during laparoscopic surgery, where inadvertent conduction and arcing of diathermy current can cause injuries. Alcohol skin preparation also conducts current. Ensure that all alcohol used is dry and that there is no pooling in order to avoid diathermy burns. In severe cases, fires may start due to the presence of alcohol near diathermy use. Thank you for watching. If you like this video, please like, subscribe, and comment for more videos.